The most common objection to the cohesive implants are that they're too firm. Well, they are firmer, and that's exactly where the benefit comes from. If you want an implant that doesn't fold or ripple, if you want an implant that maintains a specific shape, if you want an implant that's less likely to break, and if it were to break, that the gel would be less likely to migrate, well, then the price you pay is that it's a little bit firmer. But realize that it's firmer, it's not hard. There's a difference between firm and hard, and in fact, I think that firm to most people would be considered an advantage. Let me show you what I mean. In a regular silicone implant, it's soft and it's squishy, but it can form little folds, and there's no real specific shape to it. If I turn it around, it'll just adopt to any old position. Whereas the gummy bear implant, by being more cohesive, has a very specific shape to it. Look, I even turn it upside down and it still maintains the shape. In other words, the shape is molded into this, so that when I put it in the body, I can add volume where I want the volume to be. So, to reduce the folds, to maintain the shape, the price is that it's a little bit firmer. To me, that's an advantage. It gives you peace of mind that you know it's more durable, that it should last longer, that it has a particular shape, that it won't fold. But other women want the softest and most squishy implant possible, and that would be a regular silicone implant. In a practical sense, the only patients I've ever had complain about this implant being hard have been people who were a little older and had more lax, more mobile breasts. Imagine a woman that's lost weight or breastfed a few children, in which her breast was naturally had a lot of movement to it. And if the breast is highly mobile, they tend to feel this stiffer implant a little bit more. And probably for those patients, they're better served with a soft, squishy implant. But a younger patient with a firmer, tighter kind of breast, they don't notice the difference in firmness of this at all. Oh, and remember there's one final issue, which is that the rate of capsular contracture, the formation, your body forming scar tissue around the implant that gets hard, is about 75% lower with this implant than this implant. So, while in the best case scenario in which both implants have very little scar tissue, this one would feel a little bit softer, this one is still more likely to form thicker scar tissue. So if you take all of that into account, I'm not really sure that there's that big of a difference in the firmness between the two. In conclusion, it is firmer, it's not hard, most people don't notice much of a difference, and whatever difference you may notice, remember, it's there to maintain shape, it's there to reduce rippling, and it's there to create longevity. Thank you.